I'd like to read to you a couple excerpts from a story posted on CBC at the beginning of September about where COVID-19 could be heading in Ontario. Here's the headline of this story. How bad could the fourth wave get? Buckle up, it could get worse than the third. Wow, that's quite something. Buckle up, they're saying. They're using the theatrical language. Although in all fairness to them, a lot of media outlets were actually running similar stories at the time. Okay, so the story, this is how it begins. Unless we change course, the London region is likely to see a fourth wave that is worse than the third, says Western University professor and Ontario Science Table member Lauren Cipriano. Okay, interesting story there. Unless we change course. And when she talks about London, Ontario, I mean, generally Ontario numbers all across the province, they kind of follow in lockstep. So I think it's fair to say this is a prediction for all of Ontario, really, not just for London. Continues, Cipriano, an associate professor in Western's Schulich School of Medicine and Dentistry, as well as the Ivey Business School, used dynamic compartmental modeling to project the number of COVID-19 cases in Middlesex, London this fall. Well, there you go. Do not even begin to sort of doubt or question this, because this is not the regular modeling from before. This is dynamic compartmental modeling. So this is like, takes it to a whole new level. This is like total trust the science overdrive here in this situation. Okay, the story continues. They ask, it's a Q&A format. What exactly have you found? Our projections for the fall indicate that if we stay on the current course, we will have more infections in our community than the hospital system will be able to handle. It'll be worse than wave 3. And then the question is, what are the things we need to do to prevent this? And some of these things include reducing unnecessary contacts, capacity restraints on indoor environments, and a lot of encouragement around work from home. This story posted on September 8th, which, if you go back and look at the data, was the peak of the fourth wave, if you can even call it that, which pretty much failed to materialize. So there's a bit of a wave beginning, and then it peaked around the time of this story being published, and then the 7-day average has slightly decreased. Now, I'm not someone who does dynamic compartmental modeling, so I'm not going to try and tell you where things are going to head next. I'm not saying it's all disappearing. Maybe there'll be a rise again. I don't know. But this was the period that this story and many others, I'm not trying to pick on this one particular story or this one particular person and her predictions, because a number of people made predictions with their modeling. They all said around about now, this is when things would just be going absolutely rampant. And they said schools being reopened, that would be a driver of it. I remember people saying to me, they said, hey, Furey, when do you think the schools are going to be shut down again? Just before they reopened at the beginning of September. Will we make it to Thanksgiving? Yeah, we've made it to Thanksgiving. We've made it beyond. And things are going pretty much just fine. And we have this person quoted saying, you've got to reduce contacts. You've got to have capacity constraints. Well, people are just increasing contacts. Capacity restraints have been lifted all across Ontario. People are going to large sporting events. And guess what? The numbers continued to decline. The averages continued to decline. Look, all I'm saying is that there is this excessive fear-mongering over the fourth wave. Very serious, top-notch science, dynamic compartmental modeling. It was that scientific, that high level. And we had all these fear-mongering stories out there. And guess what? It just didn't come to pass. So can we at least equal the level of reporting on how this actually did not come to pass? And don't worry, folks, for those who internalized all of those anxieties about the fourth wave, can we at least do that? Can we at least acknowledge, have a bit of discussion, have a bit of reporting on the fact that all of this excessive fear-mongering, thankfully, because of course it is good news, did not in fact come to pass?